ADHD, also known as ADD, is a psychiatric disorder involving a group of key skills known as executive functions. These functions impact the ability to focus, organize, use working memory, and other executive skills. These subjects also have challenges in more than one social environment, for example, at school, at home, and in friendships. I won't dive deeper on what ADHD is. You can easily find more information on the internet. The current best treatments for this condition is Adderal, which basically is a form of amphetamine, and Ritalin, with a chemical name of Methylphenidate. As with all synthetically produced medication, both of these drugs have side effects and can sometimes give more negative effects than positive ones. The mentioned drugs have their own share of side effects, such as loss of appetite, sleep disturbances, and nausea. This raises many questions, and one of them is, are there any alternative treatments? In the Medical University of Iran's capital, Tehran, a study was made to compare the treatment effects of Ritalin with the expensive spice called saffron, which is mainly produced in Iran. The study was done by senior author Dr. and Professor Shaheen Akhondzadeh, who stated that, from this preliminary study, the main point is that we can consider saffron as an alternative to stimulants in patients with ADHD. About 30% of children do not respond to Ritalin, leading to a search for non-stimulant strategies. He states that many antidepressants have been used as alternative stimulants in patients with ADHD that cannot tolerate Ritalin or do not respond to Ritalin. Moreover, the antidepressants themselves are also associated with adverse events, with results that are often unsatisfactory, the author notes. Saffron appears to increase the reuptake inhibition of dopamine, norepinephrine, and NMDA receptor antagonists, and GABA alpha agonists, making it a potential rival treatment to these patients. Not only does it have a similar mechanism as Ritalin, it also mimics the function of antidepressants. The randomized double-blind trial had 54 subjects, 27 in each. Of these, 25 patients in each group completed the trial. The first group received 0.3 to 1 mg per kilogram Ritalin per day, while the second group received 20 to 30 mg of pure saffron per day over a period of 6 weeks. No difference was found in parent ADHD rating scale scores between the two groups. It was demonstrated that both groups had significant effect of both treatments on improving their ADHD scores, and it only took 2 to 3 weeks to notice the significant changes. Also, no adverse events were recorded, and non-serious events were similar between the two groups. In other words, they had basically the same effects. Because saffron is produced in Iran, it is much cheaper than common stimulants such as Ritalin per dose, since every patient only got about 60 mg of pure saffron per day, making it a much cheaper alternative to our beloved Ritalin. The author mentions the fact that the quality of the saffron in Iran probably has a higher quality than in other countries. He also mentions that other humans with other genetics might have a different response with the saffron treatment. So in conclusion, yes and no. High-quality saffron will very likely give you a similar result. However, these are preliminary studies that haven't been tested on a wider population, so it isn't 100% sure that you'll have the exact same results. Ask your doctor and see what he or she says. I hope you liked this video. Please, support us by liking and subscribing. If you have anything to add, comment in the section down below. Hope to see you soon. Take care of yourselves.